So, what would you say are some of the greatest pieces of misinformation being circulated right now?
I think some of the greatest pieces of misinformation are that the summertime is going to blunt or dampen the number of cases we have. Um, we don't know that for sure. I know that my parents were telling me the other day, and my parents live in the Middle East, that, oh, it's okay. Once it becomes summertime, the virus won't be able to survive in the winter. And I'm
Yeah,
going, but you guys live in the Middle East, and right now it's quite warm there. So I don't think that's going to make a difference. Allahu alam, it might,
yeah.
but from what we can tell, because this is a global pandemic and it's affecting places like California, places like Australia, places like the Middle East that are already quite warm and temperate climate zones, I don't think it's going to make a big difference in terms of the number of cases we see. So people hoping for a change in the weather to also bring a change in the fortunes for the infection rate, I don't think is a reality.
Okay. So, because yeah, I heard that as well. That okay, once it's summertime, I think one of the earlier articles said that don't worry, once it's summer, a lot of viruses don't operate better in certain seasons. Um, and then this was I don't know, giving a little bit of false hope to people. But you're absolutely correct. It's worldwide. Even if you look at Italy, one of the worst areas, there's areas where it's a more Mediterranean temperate climate, as you mentioned, the United States. So what else is out there that's circulating around with people that you think needs to be clarified?
I think one of the biggest things that needs to be clarified is that this is not an airborne virus. The virus
Okay.
needs to get onto you somehow, whether it's either through direct contact with someone, so touching someone, shaking hands with them, hugging them, um, touching an article of clothing that they had that they've coughed onto or sneezed onto. So it needs either direct transfer from person to person or indirect transfer from surface to person. So if, for example, I had sneezed all over my laptop, and then later on my brother came and typed on that same keyboard, he would potentially be exposed to that virus. But he's not going to catch the virus from us being in the same room and breathing the same air or being in the same proximity. So it really is person-to-person contact or person to surface and then surface to new person contact that's spreading this virus.
So you need some type of medium for
Absolutely.
to
Yeah.
transfer. Okay. So if you're in the same room as somebody, because I've seen that, someone has said, "Oh, I was in this room or I was in the same convention as this person who got this virus," and they're starting to freak out, even though they don't have any symptoms or anything like that. So you don't have to go to that level of anxiety.
Correct. Yeah.
Okay. What else is out there that we should clarify?
I think the other biggest thing that we have to rely on right now is that our public health officials are the source of truth for all information, for all isolation, and for all symptom information. So whatever you see on WhatsApp, Facebook, Instagram, social media, wherever you're getting that information, make sure that it's verified and coming from a trusted source. Make sure that it's not, some dude sitting in his living room on a webcam telling you information, but make sure that it's actually verified, trusted information coming from a provincial or a federal or even an international information source.
Okay. And also, I think we should appreciate that this information is continuously changing, because I feel that there's a litany of experts out there on news broadcasts, putting out videos on YouTube saying, okay, and they're all doctors and experts. And sometimes there is conflating information, because there are experts who have said that viruses, these types of respiratory viruses can be transmitted airborne, So how do you kind of sift through all of this? We should just focus in on what the Canadian officials are saying, or
so the Canadian Department of Health, as well as your local health authority, are the sources of truth, the sources of information. While it is possible that people are seeing one-off or unique cases, they don't have the same resources, nor do they have the time to investigate and decipher as thoroughly as the Canadian Department of Health does, or as your local health authority does. If you're talking about a physician in an emergency room mentioning that she or he saw something, or your friend saying, oh, I was at the supermarket and so coughed or sneezed. While it might be true, they haven't really investigated that. A lot of that is anecdotal, and it's a lot of our fears and anxieties play into those things.
Yeah, I think another anecdotal piece of information that I read earlier that was coming out of Italy. They said that and this was coming out from some of the doctors. But they mentioned it was anecdotal, that they felt that ibuprofen was not as effective as Tylenol or acetaminophen, and they were saying that ibuprofen perhaps worsened the symptoms of their patients. Have you heard anything in regards to that?
I have, and I don't know how much truth is behind that. A lot of the data and a lot of the studies are still ongoing. I mean, we're still only kind of, at least for Canada, in week 4, week 5, depending on where you're counting our first case to be, whether it's Canada-wide or whether it's in your province. So we're still in early days. We don't have all that information. But again, I refer you back to Health Canada or to your local health authority with the best information. To the best of my knowledge, it does not make a difference if you're using ibuprofen or Tylenol or acetaminophen or aspirin to treat the symptoms of a fever, because all those things are doing the same thing, and that is symptom relief.
Yeah, and that's what was, and then you had some videos that were coming out saying avoid this if you have COVID-19, and there's all this information. Avoid ibuprofen, and in Europe, I believe they referred to acetaminophen as paracetamol.
That's correct.
So they were saying some of the clips were coming out saying use this instead of ibuprofen. But sometimes I also believe when the situation is so chaotic and dire, and you have to react very quickly, you can't always look at data and studies in the moment in an emergency situation.
No,
so perhaps there is room for anecdotal information that we, during this course, right? And how should we gauge that? So you have people on the front lines are dealing with this, and they're just saying, oh, through my personal observation. Should we still give that some weight?
I think we should, but I think it bears some investigating. So I'm not saying that the anecdotal evidence out there or what people are seeing, frontline staff that are treating these patients, is not valid. All I'm saying is that you have to make sure that you're comparing apples to apples. And so a little bit of investigation, a little bit of a background behind those people and what particular set of cases caused them to have a better or a worse reaction than someone else on a particular medication needs to be investigated. But I'm not saying that you need to run an international, worldwide, double-blind, randomized controlled trial to do this.